how are you doing?
Great.
Good to see you. So this is my lobby of my Victorian, and this is my awards wall of a lot of my top doc plaques. Let's take the elevator up. So this is my reception area, one of my lovely receptionists. I love my, my name on the wall back there. And then these are some of the products that I sell with my book, and just some of the before and after shots of different things that I think I can achieve for patients. And people are interested. You have to advertise, and I think this is a good place to start your internal marketing, is right here. My staff, I get compliments about them all the time for being warm, appropriate, and friendly. I have, let's see, 12 people working for me altogether, myself included in that, and then I have an off-site biller. And all our insurance needs are handled over there. We do mostly cosmetic, about 65% cosmetic, and then the rest medical. I do a lot of skin cancer and acne, as well as all of my cosmetic treatments. Here's our waiting room right this way. A lot of my patients joke and they call it a living room. I wanted someplace that was super comfortable. I have a lot of people in and out of here. I wanted someplace that people could just feel a little bit relaxed. People are apprehensive sometimes before going to see the doctor, that type of thing. I also do a lot of internal marketing from here. I have a lot of brochures, a lot of magazines in here, a lot of different quotes and things I was featured in. That way people can get more of an idea of what I offer, and then we streamline it when we get into the rooms upstairs, which are the patient rooms, which I'll be showing you next. So now, these are some of my patient treatment rooms here that I do filler, Botox, medical procedures in. This is my Fraxel room right over here that I use, that I really love a lot, that gets a lot of use, this machine. I do this for acne scarring, for stretch marks. I do this for photo damage, and a ton of other uses for the Fraxel. I really love the machine a lot. I've had heavy use of that machine. In this room, we have my laser hair removal machine, which is on the entire day. It gets a ton of usage. And I also will have patients for Botox for hyperhidrosis in here, because this room tends to be stuffy all the time because the machine, gives heat to the room. So my patients will be in here sweating so that we can see where they sweat for when I'm doing the Botox under their arms. In addition, I use this room for filler, Botox, chemical peels, total body checks. I use the room for it all. So now, before we get to my Exilis treatment room here, this is just my little menu of services. And what we did is we just decided that we were going to do kind of like service pages here. You see new Exilis. We're talking about vein therapy, skin rejuvenation, laser treatment, skincare products, Botox and wrinkle fillers, and about our physician. And then we have special offers that we usually keep here. But we always have all the special offers on the internet, because that's really, when people are browsing, that's where they really see things. And then we have a copy of the Exilis brochure here. We go through and we talk about before and afters. I don't have any of my patients' photos in this specific book. I will have some of them up on my website that I'm in the process of revamping right now. And then it just goes through vein therapy. I do a lot of Botox and fillers in here. I do a lot of Fraxel. So it just talks about a lot of the different treatments. And I love this book, and I think it's something that I recommend pretty much for everybody's practice. So this is my Exilis machine right here. And what I like about it is it's got the lighter handpiece. I always use it with gloves, by the way, for every patient. And this one you're pressing here. This is for the face. And this one's just fabulous. It's really easy to use. Obviously, this is the tip that's contacting the patient's surface of their face, the upper eyelids, the face, the chin, and the neck. We use this lighter handpiece for. And you're basically looking at the power and the duty factor. And then we just hit start. It's, quite simple. So we use it, like I was saying before, for eyelids. We use it for the Nike swoosh on the face. We use it for the chin, and we use it for the neck. And my patients find it eminently tolerable. So there's, I would say, virtually no pain with this machine. And it's fabulous. So that's the facial handpiece. And then this is the body handpiece. You can see the temperature on here in real time. And it's just kind of awesome. It's a kind of either linear or circular motions. We're doing more linear motions these days, and works really great. My patients love it. And this is the bottom part of it. This is the part that contacts the patient's skin right there. And with this handpiece, this is a little bit heavier, a little bit bulkier. It gets right in there when I'm doing tightening on a stomach or melting on a stomach. I do bra fat. I do arms on this. I do inner and outer thighs, buttocks, love handles, above the knee and above the ankle, all with this. And it just works really, really well. And the technology, what it does is it has a perfect system where it heats up very, very quickly, and then it cools off fast when patients get a little bit uncomfortable. So my patients liken it to something that's warm, but something that's not painful at all. So they have energy flow control, it's called. So that's the perfect amount of heating coupled with the perfect amount of cooling so that it doesn't really hurt them at all. Then when they leave here, their skin might be slightly red right after the treatment session. They have no downtime. They go right back to what they're doing. Many of my patients come in, have their scheduled appointment, leave, and go right back to work. So it's not like the type of thing where you have to take days off from work. What I also like about both of the handpieces is you can see, as well, especially with the body handpiece, in real time what the actual temperature is. And if it gets too hot, it has a cutoff so that it never overheats. And now with both of them, it's focused radio frequency. So what that means is that when you're doing the heating for melting of the fat cells, it's going deep down, but it's keeping the superficial layers of the skin not too hot so the patient doesn't feel uncomfortable. Whereas with the skin tightening, the focused radio frequency is more on the top part of the skin, obviously much more superficial, and that's for the skin laxity and the tightening. And like I said, both of them are basically there in terms of decreasing the laxity in the skin and helping to decrease the wrinkles. The other thing I like about this machine with the facial handpiece is you really see the collagen refill technology, they call it. You can actually see, even on the first treatment session, when you're doing the Nike swoosh in here, like I was saying, the actual tightening of one side versus the other side before you do it. It's unbelievable. And what that does is that's really tightening the skin, and it really helps to define the features better as your face gets older. Now, once the fat cells are melted with this device, I encourage patients, I explain to them that this focused radiofrequency technology will heat up the fat cells. So they're adipocytes in terms of our medical language. And that means the fat cell breaks apart, and that's wonderful. And so what we do is we want to force that into the lymphatics and out. So I really have them hydrate. That is, they drink tons of water. I have them drinking water the day before they come in and for at least 2 days after. So it's 72 hours of an increased water intake. And I really do honestly feel that that helps a lot. My patients that have had the most results with the Exilis are the ones that have hyperhydrated. I literally had one of my patients lose 3 inches. And I don't market it for necessarily losing inches. I say it's a body sculpting, body shaping when people are using it on the body, because obviously I have a lot of my patients that use it on their faces as well. But I don't market it as if they're going to lose 2 to 3 inches. That's a wonderful result, but that doesn't happen in every case. But everyone will feel better in their jeans, will look better in their clothing. And then, especially if you're drinking tons of water, you will have better results. Anyone is a candidate for Exilis between, I would say, the ages of 25 to, I think my oldest patient's in her mid-70s right now, but that doesn't mean that one of my 93-year-old patients is not considering it. A lot of my patients are in good shape and they just have stubborn deposits of fat. For me, what attracted me to the machine last year, I was looking at all these different devices and I was looking for something to get rid of my stubborn love handles. And I run 20 miles a week, but I eat too much sugar, especially chocolate. And I couldn't get these love handles off. And after 2 treatment sessions with the Exilis during December, I started noticing a significant difference in my love handles. And I thought to myself, oh my God, this really works. I have to get this machine. My patients like to hear that I've done it on myself. My patients like to hear that my husband has tried it. And my patients like to hear that I think it's safe and effective. And it's what they want in terms of non-invasive technology.
Okay, here's the water.
Thank you so much.
You're welcome. And then I'll see you for your next treatment
I'll
next
see you next
week,
time.
okay?
Great. Thank you so
Okay,
much.
You're welcome.
Feels good.
Have a great day.
You too.
The minute patients hear that they don't have to get cut and they don't have to get necessarily anesthetized and they will see results, they're interested in learning more. So I've had people literally walk in off the street to make appointments that were never my patients before. The machine, I feel, is at a cost where you can recover the cost of the machine within 3 to 4 months of great internal marketing, and that's before you even put an ad in the newspaper. So I think it's well worth it in terms of your bottom line. With this body shaping device, what I'm finding is that patients move from me doing their outer thigh, then I'm doing their arms, then I'm doing their mother's chin, then I'm doing their neighbor's neck. So it's the type of thing that builds, that people like. And I've had many, many patients come back in. My patient that's had the most treated has had 4 separate areas treated. And next month she's going to have her 5th area treated. So she's thrilled with this device. One thing that's frustrating about the laser/device market, because obviously this isn't a laser, this is a monopolar radio frequency device, is that there's a lot of consumables. What I like about the Exilis is there is the grounding pad, which costs about $2, and some baby oil. And that's it. There is no extra consumables. So therefore, my patients come in, we're using the same tape measure and the same place to weigh them every single time, and it works. And it works because I don't have to spend a ton of money on consumables. So I love that.